All right, so nursing school, right. It can feel like a whirlwind of like exams and clinical rotations, and honestly, sometimes it feels like one giant crisis after another. But today we're taking a deep dive into a topic that's really going to equip you guys with some serious skills crisis intervention. But this time we're talking about it from a professional standpoint.
Yeah, think of it as like adding another tool to your nursing toolkit. This one's going to help your patients navigate those moments when everything feels like it's falling apart.
And to guide us through this deep dive, we're going to be using crisis intervention, principles, and practice. This book is like a roadmap to understanding like what a crisis actually is, how it develops, and what we as nurses can do to help.
And I'm here to break down some of those tougher concepts, and share some insights from the field.
Perfect. All right, so let's jump right in. First things first. What exactly defines a crisis?
Well, our source actually defines it as like an event. It's a sudden event, a time-limited event, and it's something that someone experiences as incredibly distressing. It's that moment when their usual coping mechanisms and support systems just aren't enough.
So it's not just your average everyday stress. There's got to be something more to it, right?
Exactly. You hit the nail on the head. A crisis doesn't automatically mean someone has a mental illness. But if it's not addressed in a good way, in an effective way, it can lead to bigger problems down the road, for sure.
That makes sense. It's like when you're in the middle of, code blue and the patient's crashing and you have a million things to do all at once. It's that feeling of just like overwhelm, where you don't even know which way to turn. That's a crisis.
Absolutely. Or picture this, like you're studying for that huge exam, the one that basically determines like your whole semester grade, and suddenly you realize you're totally lost on this one really critical concept, and the panic starts to set in. The fear of failing. Boom. That's a crisis in action.
Okay, so I think we're all feeling a little more familiar with what a crisis is. But how does it develop? Is there a pattern? Can we recognize a pattern?
There is. Our source outlines these four distinct phases in the development of a crisis. And understanding these phases, it's really crucial. It can be crucial for nurses when you're actually assessing a patient in crisis. It's called Kaplan's model, and it basically shows how the anxiety can escalate if the crisis isn't resolved.
Okay, I'm all ears. Tell me about phase one.
So phase one, this is all about, the initial exposure to the stressor, the trigger. This is what sets everything in motion. Anxiety starts to build. And the person, they're going to try to use their usual coping strategies to deal with it. Sometimes those strategies work and the crisis is averted. But if they don't, well, that's when things can escalate.
So what happens in phase two then, when those go-to coping mechanisms just aren't enough?
Exactly right. So in phase two, those strategies that they normally use, they're not working anymore. The person feels even more distressed, more confused, helpless. Imagine that code blue scenario again.
Oh.
Like you're doing everything you learn, but the patient just isn't responding. That feeling of helplessness can be so intense.
I can already see how recognizing these phases, like it would be so helpful to be a game changer as a nurse.
Absolutely. As nurses, we're often, that first line of support. We're the first ones there for those patients in crisis. So understanding where they are in this process can really help us tailor our interventions, to their specific needs.
This is fascinating. Okay, so what happens in phase three? Do things start to get better?
Phase three is interesting. It can actually go one of two ways. The person might, they might try some new ways to solve the problem, or they might finally reach out to their support network and ask for help. If that works, then great. They regain a sense of control and the crisis starts to resolve.
But what if it doesn't? What happens then?
That's when we might enter phase four. This is kind of the breaking point.
Ooh, this is where it gets intense.
Yeah. The anxiety, it just skyrockets to like panic levels. Their thinking becomes disorganized. And they might even experience some cognitive dysfunction. This is when the risk of serious consequences starts to increase dramatically. So we're talking things like suicidal thoughts, aggression, even psychotic episodes.
It sounds like understanding those phases would be crucial for preventing those really serious consequences. But crises can be triggered by so many different things. Like, how do we even wrap our heads around all the different causes?
Yeah, you're absolutely right. And that's where Baldwin's classification comes in. It outlines these 6 main types of crises. Each one has these unique characteristics, and they each have potential challenges for us as nurses to think about.
Okay, lay it on me. Let's hear about these types.
Okay, so let's start with dispositional crises. These are triggered by an external stressor, something that happens to the person. Like, let's say a patient just experienced a job loss. Or maybe they're a victim of domestic violence. Their whole world's turned upside down, and they're just struggling to cope.
That makes sense. So it's about how an unexpected event can totally disrupt someone's life. What about the next type?
Okay, next up we have crises of anticipated life transitions. These are interesting. They're actually tied to normal developmental changes. Think about the financial strain of college or the challenges of adjusting to parenthood, even, the emotional upheaval of retirement. Now, these are expected life events, but they can still trigger some significant distress, especially if someone feels unprepared or if they just don't have adequate support.
So it's not even just about the event itself, it's about how they perceive it and how they cope with it. That's a really important point.
Yeah, exactly. Now let's talk about crises resulting from traumatic stress. These are often probably the most severe, honestly, and they can have these long-lasting consequences. So think about something like the aftermath of a sexual assault, or a natural disaster, a car accident, or even witnessing violence. These experiences, they can be just incredibly overwhelming, and they can lead to things like post-traumatic stress disorder.
I can see how those situations, they'd be so challenging to deal with, both for the person experiencing it and for us as nurses. What kind of support can we even offer in those situations?
That's a great point. And it's important to remember that everyone processes trauma differently. There's no right or wrong way to feel or react. And our role as nurses is really just to provide that safe and supportive environment where they can begin to heal. We'll get into more specific interventions a little bit later.
Okay, so we've covered dispositional crises, anticipated life transitions, and traumatic stress. What's next?
All right, so next up, we have maturational or developmental crises. These occur when someone's grappling with unresolved conflicts from earlier stages in their life. So, for instance, you might have a teenager who's struggling with identity formation and experiences a crisis. Or maybe you have an adult going through a midlife crisis and they start to question their purpose and their direction.
It's like those internal struggles finally reach a boiling point.
Exactly. Okay. And then we have crises reflecting psychopathology. These occur when a pre-existing mental health condition, it's exacerbated by a stressful event. So for example, someone with borderline personality disorder, they might experience a crisis after a perceived abandonment.
Sounds like those situations require a very careful balance. You need to address that immediate crisis, but also consider that underlying condition too. How do we even how do we navigate that as nurses?
You're right. Yeah. It's a complex situation. We'll definitely discuss specific approaches to managing those kinds of crises later in this deep dive.
Okay, good to know. What's the final type of crisis? The one we got to be on the lookout for.
Last but not least, we have psychiatric emergencies. These are the most acute and probably the most dangerous type of crisis. This is where the person poses a danger to themselves or to others. Think about things like a suicide attempt, a drug overdose, or someone experiencing acute psychosis.
Those definitely require immediate intervention for sure. Got to keep everyone safe.
Absolutely. It's crucial to recognize the signs and symptoms of a psychiatric emergency and to know how to respond in a safe and effective way.
Okay, so we've covered a lot of ground here. We know what a crisis is. We know how it unfolds. We know the different types of crises. It's all fascinating. But what does crisis intervention actually look like in practice? What's our role as nurses?
That is a great question. And that is actually one that we will dive into right after a word from our sponsor.
Stay tuned. Okay, so before the break, we were talking about all those different types of crises that we might run into as nurses, from the external stressors to those rooted in existing mental health conditions. But I want to get to, the hands-on part. What do we do when we have a patient in crisis?
Right, yeah. This is where things get real. So it's important to remember that crisis intervention, this isn't about long-term therapy, okay? This is a focused approach, short-term. And it has one clear goal. We want to help the person regain that balance, regain their function, and get back to how they were before the crisis hit, or even better.
So it's like we're building a bridge to get them back on solid ground.
You got it, 100%.
Sure.
And, just like building a bridge requires a plan, crisis intervention does too. Our source breaks it down into these 4 key phases: assessment, planning, intervention, and then evaluation. And each step is crucial to, make sure we provide really effective care that's, really personalized to that patient.
Okay, so let's walk through those steps. What about that assessment phase? It sounds like gathering information is key, right?
It is, absolutely. Assessment is all about understanding the whole picture. So we start by figuring out what that specific event was, that trigger, that kind of pushed them over the edge. What was that tipping point?
So for a patient who just got a life-altering diagnosis, That trigger would be the news.
Yes, precisely.
Right.
But it's not just about that event, right? It's about how the person sees it. What meaning do they give to this event? How is it impacting them, like their sense of self, their relationships, their hopes for the future? All of those are crucial.
Right. Like two people could experience the exact same event, but they'd have totally different reactions based on, their circumstances, their interpretations.
That's exactly it.
Yeah.
That's why it's so important to really listen to the patient. We need to really try to understand their perspective, their unique perspective. So during assessment, we're also looking at their past coping mechanisms, the good ones and the bad ones. Have they used substances to kind of numb that pain? Are they isolating themselves from people who care about them? Or have they sought out support? Have they found healthy distractions? Maybe they've been practicing mindfulness. All of these little things, they can help guide us as we put together our interventions.
So we're like building this comprehensive picture. We're looking at their strengths, their vulnerabilities, what resources they have.
Yeah, exactly. And we can't forget about safety, right? Like assessing for suicidal thoughts, homicidal ideation, that is so critical in every single crisis situation. We need to know that everyone's safe before we move forward.
Of course, yeah. Safety first, always. Okay, so let's say we've got a good understanding of what's going on. What happens next? Is that when we move to the planning phase?
Yep, that's right. So now we know what we're dealing with, right? We can come up with a plan that's really tailored to the needs of this individual. And that means, what are their strengths? What resources do they have? We want to set some realistic goals. And then we outline those interventions that'll help them get there.
So if a patient, if they're isolated and they're really struggling to cope, maybe the plan involves connecting them with some support groups or teaching them some healthier ways to cope, right? It's like giving them a toolbox, right? The tools to deal with this tough time.
Exactly. It's all about meeting them where they are and gently guiding them towards that path of healing and recovery. And in this phase, collaboration is so key. So we're working with the patient, of course, but also their family, their loved ones, other healthcare professionals. We want to create a plan that works and, that they can actually keep up with after, when we're not there.
Sounds like a real team effort, something we learn on day one in nursing school.
Right. 100%. Okay, so the plan's ready. Now it's time to put it into action. And this is where we hit that intervention phase.
This is where things get really hands-on, huh?
Yeah.
So what are some examples of interventions? What do we do in a crisis?
Okay, so first things first, we need to make sure that environment is safe and supportive. So this could be as simple as just being there with the patient, really actively listening to them and validating their feelings. Sometimes just having someone there who cares and gets it, that can make a world of difference.
It sounds like active listening and empathy. Those are like they're must-haves. It's not even about having all the answers. It's about just, being there with them.
Yeah, you're so right. It's about creating a space where they feel safe to share and to be heard, really heard. But we also have to set some clear boundaries. So if a patient starts getting agitated or aggressive, we've got to de-escalate the situation. Everyone needs to be safe. So that might mean, communicating really clearly and calmly, redirecting their attention. And if we have to, we can always call for backup, get more support if we need it.
I can only imagine those situations. They can be really intense, especially for new nurses who are, still building their confidence.
Yeah, it takes practice for sure. But remember, you're not alone. You've got your team and you have protocols, to help you. Trust your gut and never be afraid to ask for help if you need it.
Okay, that makes me feel better. So we've got a supportive environment. We've set some boundaries. We've de-escalated any immediate threats. So what other interventions can we use in this phase?
All right, so this is where we start teaching those super important coping strategies. So we might introduce some relaxation techniques like deep breathing or maybe some guided imagery. We can help them work on problem-solving skills so they can actually address those issues that are causing the crisis. It's about giving them the power, right? Giving them tools that they can use on their own even after this crisis is over.
So we're not just putting out the fire, we're showing them how to stop those fires from starting in the first place.
Exactly. Exactly. We're giving them what they need to, face life's challenges with more resilience. And sometimes the best intervention is just connecting them to other resources like therapy, support groups, crisis hotlines. It's about knowing when to call in, the experts, the specialists.
So our role, there are so many layers to it. We're providing direct care, we're teaching these skills, and we're coordinating care so they can, get access to the right resources.
You summed it up perfectly. So that leads us to that final phase, evaluation. Once things have calmed down a bit, that immediate crisis has kind of subsided, we take a step back and we ask, okay, how did it go? Did the interventions actually work? Is the patient feeling more stable? And have they learned some new coping skills that they can use in the future?
So it's not just about responding, it's about learning,
Yeah,
right? Learning from the crisis and preparing for what comes next.
exactly. The evaluation phase, it's about looking ahead. Are there any challenges down the road? What needs do they still have? And then we can adjust the care plan based on those things. We also want to help the patient, come up with a plan for how they're going to manage stress in the future. What did they learn from all this? What triggers should they be aware of? And who can they call on for support?
So it's not just about right now, it's about equipping them for the future,
Yeah.
right? So they can face it with strength and be more resilient. But, our source also talks about disaster nursing, right? That's a specific kind of nursing that deals with these huge, large-scale crises.
Right, right. Disaster nursing, it's a whole other ballgame. It takes specialized knowledge and skills to deal with the unique things that disaster victims go through.
So what exactly is disaster nursing? What kind of um, situations are we talking about?
Yeah, so basically it's about providing care and support, like psychological support for, individuals and communities, people who've been hit by these huge natural or man-made disasters. So think about the aftermath of a hurricane or an earthquake, a terrorist attack, even a mass shooting, right? These are events that cause like widespread devastation and a lot of trauma.
Yeah, those are incredibly traumatic events, both, physically and emotionally. I can't even imagine.
Exactly. And you see a whole range of reactions, psychological reactions. So you have anxiety and depression, you have PTSD, and then you see things like substance abuse. And we can't forget about the kids, right? They're especially
Wow.
vulnerable. You might see regression, nightmares, really bad separation anxiety.
Oh, that's so sad to think about. So how do disaster nurses even, like, how do they approach those situations? What are they trying to do when there's so much, suffering?
Well, the top priority, always, it's got to be safety. Always safety first. Disaster nurses, they work so hard to make sure that the victims are okay, physically and emotionally. So providing those basic needs, food, shelter, medical care. And they also try to create these safe spaces where people can, process what happened and start to heal emotionally.
So it's not just about treating the physical injuries, it's those invisible ones too, right? The ones that can really, stick with you.
Exactly. Disaster nurses, they understand that, that psychological trauma, it can be just as bad, as a physical injury. So they make sure that mental health support is a priority. They encourage victims to, talk about their feelings. They validate their experiences, and they make sure that they're connected to resources so they can get long-term help, counseling, support, all of that. It's like a lifeline, when everything else feels chaotic.
It sounds like such a challenging field, but it must be so rewarding too, right? To be able to help people through, a crisis like that. It must feel amazing.
It is. It really is. It's not easy, though. Disaster nurses, they're often working these really chaotic and unpredictable environments, dealing with so much suffering, so much loss, but they get to make a real difference in people's lives. And that's got to be incredible to help them, rebuild and recover after something so awful.
I feel like this whole deep dive has been so eye-opening. I mean, we've covered so much from those phases of a crisis to the role that nurses play, both with individuals and in these huge crisis situations. Before we wrap up, what would you say is like the one thing you want our listeners to take away from this? What's the key takeaway?
When you're a nursing student, it's so easy to get caught up in the technical stuff, right? The meds, the procedures, all the diagnoses. But at the end of the day, nursing is about connecting with people. It's about being there for them when they're at their most vulnerable. And it's about showing compassion. Learning about crisis intervention, it's not just about getting those skills for your future career. It's about understanding yourself too. How you deal with challenges in your own life.
That's such a good point. I mean, we've all had crises, right? Whether it's, freaking out over an exam or those personal struggles that just feel, completely overwhelming. These concepts, they apply to us too.
100%. Recognizing those phases of a crisis, figuring out how to cope in a healthy way, and knowing when to reach out for help. Those are skills that are going to help you in your personal life just as much as in your career.
So it's not just about being a better nurse, it's about being a more resilient person.
I love that. Exactly. And think back to those 6 types of crises we talked about. Have you experienced any of those? How did you deal with them? What did you learn? When we think about our own experiences, it helps us be better nurses for our patients.
Wow, yeah. It's so powerful to connect these concepts
Yeah.
back to our own lives.
Yeah.
Makes it so much more meaningful.
It does. And just remember, you're not alone in all of this. Everyone has challenges. Everyone goes through crises. It's all about building up that resilience so we can get through the rough patches and come out stronger on the other side. You're all going to be amazing nurses. I just know it.
And knowing that there are people out there who are, trained to help, like nurses, it's really comforting. Honestly, it's
Yeah.
a privilege to be a part of this profession.
It is. So as you continue learning and growing, throughout nursing school and your career, remember how important compassion is, empathy, and those intervention skills we talked about. You guys have the power to really make a difference, especially for people who are, facing some really tough times.
Well, this has been such an amazing deep dive. We've learned so much about what a crisis is, how to recognize the signs, and how important nurses are, when it comes to supporting people through those times.
It's been a pleasure being here. And to everyone listening, remember, you're capable, you're resilient, and you have the power to make a real difference in the world, one crisis at a time.
I love that. Well, thank you so much for joining us on this deep dive into crisis intervention. And until next time, stay curious, stay compassionate, and keep learning.